All right, so our group is going to be discussing cultural care in nursing, and we're going to be discussing first some concepts of Leninger's theory that could assist in assessing a patient and providing cultural care based on the scenario of a kidney transplant with a donor and a recipient. So the first one that I thought of was that cultural care competence can just help improve compliance, which can in turn help improve their healing and overall wellness in the future. Um, so that is a priority, just to better understand where they're coming from and their individual situation. What do you guys think of?
When I was kind of just like thinking about what I would apply to a kidney transplant, what would like best kind of help with outcomes, I kind of thought of the three modes that Linger talked about, like the cultural care preservation and or maintenance, and the accommodation and or negotiation, and the restricting and or patterning. I thought this was could be applied just in the sense that, there's a lot of things that transplant patients are recommended to follow. And sometimes just for certain individuals and like their cultural needs, you need to take into consideration that these can't be applied to all patients the same way. So just kind of like keeping that in mind to like nursing actions to be kind of modified to fit the cultural needs and values of the patient with using that.
Yeah, I agree with both of you. I think like as Alama 2020 said in the text that like um, it starts by kind of like allowing the person to just like flood you with information about the culture and absorb all that, because once you understand their culture and where they're coming from, then you can, you know, support those three like processes that Tara talked about. So if it's something, I don't recall if it was in the Alama text or in the other article that they talked about the culture that eats the raw kidney. Like, even though that's something that we may identify as like having potential risks, once we understand that that's part of their culture, then we can go to like the different modes and say, okay, instead of doing this, let's try something along this route that still abides by your culture, but that is beneficial for you during your post transplant recovery.
Yeah, definitely. I think these are especially important because there are two patients involved in this kind of surgery, and there can be really serious complications for both of them. So aside from that, like what specific kind of questions would you ask patients, both the recipient and the both the don and the sorry, both the recipient and the donor when you're doing this assessment?
I think some questions that you would ask in the cultural care assessment would be they'd be long and they'd be kind of in depth. This is a high risk surgery for both of them, and there's many ethical considerations to consider and the potential complications. So based on Langenger's theory, some of the questions that we would ask the donor would include, how can we best prepare you for this procedure? What level of communication would you like to have with the recipient and their family? Some other questions that we would ask the recipient would be, what can we do to help prepare you for this procedure as well? And then, how can we help you with readjusting with the post-op? These questions just help identify the important needs and prohibitions that are crucial in performing a cultural assessment. Oh my gosh. These just address anything that, if they need to avoid certain products or foods or even medications. And then, if they have preferences for if they want to have visitors, if they want to meet the family, those are also like important things to consider along, like aside from just overall what they need medically.
Yeah, I also think it's important to like focus the question based off Leninger's Sunrise Enabler, because in using that, if we use that as like the base for questioning, then we're able to hit, most of the important aspects, which include like not just the medical stuff, but also like political and legal factors, economic factors, educational factors that will affect not only their ability to like comprehend the teaching that they need to have post transplant, but also their ability to execute that teaching once they're in an outpatient setting away from nurses and doctors at at the bedside.
I definitely think those are super important. And Sierra, I like that you included food because that's something that we might not think about every day, but that can definitely change. Someone's spirituality or religion can definitely impact what foods they eat or eating patterns or habits if it's like a certain time of year or anything. So who would be in charge of conducting this assessment?
So I think a lot of this would be, a nurse's responsibility, only because nurses spend the most time with patients. And according to ALAMA or WEBI ALAMA 2020, it's a process, right? So like I said, if you're using the Sunrise Enabler, it allows a nurse to like just take in everything that's being told to them, which isn't going to be that's not going to occur in like a 2-minute conversation with a provider. It's going to be something that occurs over hours or days or even weeks, depending on how long the post-transplant recovery stage is. And so I think the nurse would be best suited to ask these questions and implement nursing decisions, not interventions, based on what they learn from the patient.
I definitely agree with you. I think it would be really valuable if there was like a transplant nurse coordinator or something who could do the same assessment on both people. That way they could, hear face to face like each person's answers and no information would be lost in reports or translations. So, but of course, that's just not always possible depending on the urgency or where the patients are located. Um, and I think it would be best if it was face to face. But of course, that's just again not always possible depending on the people's situations. Sometimes we don't have a living donor, so we're relying on their family maybe, or maybe the recipient isn't conscious if their health status is very poor. So it can just be difficult. Do you guys think we should focus more on open or close-ended questions?
You can go. I was just gonna say that I feel like having more open-ended questions would be better, just because it would help facilitate discussion and encourage the patients to talk about their cultural preference. If you're just giving them yes or no questions, you're really not going to find out like what they truly want or what they need.
I also wanted to point out, I just think even if it is the like nurse who is asking all of these questions or like the transplant coordinator, I think it's also important as like a nurse that our role is to make sure that everyone on the healthcare team is like informed of like the information. And I know in Web Alama 2020, for the Sunrise Enabler, using this like kind of like model for asking questions, it's supposed to create like an open mind and kind of let us know that our like cultural beliefs are not always the same as our patients. So kind of using the same for everyone that's involved in the transplant, just because there is so many people that will be like on the care team and involved, so that everyone has to be kind of on the same page for the benefit and like for the best outcome of the patient too.
Yeah, I definitely agree. It's super important to make sure the whole care team is on board and on the same page. That way the patient gets the same care from everyone and gets all of their needs met from everyone, not just one person having that information. What do you guys think would be the best like schedule for asking these questions? Like when, or should they be asked multiple times?
I think like a lot of patients that are doing a transplant surgery, it's like a very long process for them to be considered candidates. And I also think that people are more prone to kind of like opening up over time as they like develop relationships. So even though you don't want to like ask someone the same question repeatedly, it could help that yes, they should be asked prior to the surgery when they're at the facility. But even if they do have prior like just like interactions with the transplant nurse coordinator, that it might be helpful for them to like start the just like asking these questions over time just to kind of create a like full picture for the care team.
And I think it's a really good idea. I think it might be good to repeat the assessment, maybe after the surgery or so at some point during the recovery process as well, just to like continue checking in. Because it can just be like such a emotionally taxing surgery.
Yeah, I agree. Because even in the BAT et al. 2015 article, it highlights the fact that like the Joint Commission and CMS requires that like hospitals ask about these like cultural importances to the patients. But in their study, they found that that oftentimes wasn't happening, and that in the portion of the electronic health record that talked about like spirituality and culture, it was often left, bless you, is often left um, blank, or that they didn't ask about it. And so like perhaps implementing like as part of the intake assessment, preset questions that are asked about culture and diversity and stuff like that can allow for it to be collected, which helps for like pre and post-op treatment, along with meeting the criteria set by like the Joint Commission.
Certainly. I think it would be important as well to educate the transplant team and the other care staff involved with those patients on the importance of these questions, so that, you know, it doesn't just feel like another task or a list of things to do, but they can really engage with the patients a little bit more and get more additional information out of those answers.
Yeah, and the BAT et al. 2015 article also supports that, and that like after the nurses did get that education, they were finding that there was more like nursing decisions and implementations made regarding the you know, patient culture and stuff like that.
Yeah, absolutely. That kind of leads to my next point, which was how does this assessment process change the outcome? Like, what improvements do we see from completing it?
I think the assessment process would just allow patients to both individually feel more comfortable with the procedure. You know, someone's getting a kidney and someone's losing a kidney, so that can be completely different for each person. And then just for the nurses caring for them as well, you know, they're able to understand their needs or what things that they need to avoid. And rather than having like a bias towards it, they understand it and are, you know, respectful of it. And it also just helps, you know, the nurse to learn how to communicate appropriately with the patient, and then like understand their comfort measures as well. And I think just like in general, it just makes the care more individualized to each patient. So, you know, like I said, it's going to be different for everyone. So being able to best adjust your care to each person, both for the nurses and the physicians and anybody else, will provide the best experience for both of them.
It also will help like kind of motivate the patient to be more engaged in the nursing actions if they feel like they kind of have like been a part and like that it's like individualized to them instead of like being forced upon them, and not something that they feel like is going to like best help them get better.
Yeah, I think it's really important to individualize our care plans, not just for cultural considerations, but to avoid sort of dehumanizing someone in the hospital or thinking of them as just your daily assignment or another room number. And I think that this practice can really help connect with patients a little bit more and foster that better relationship. So I also wanted to talk about Purnell's cultural competence model. Are there any concepts that you guys recognize that would assist in organizing better culturally based care?
So I think one of the most important concepts of Purnell's is like the different things that influence like the individual. So like in the middle, there's like the unknown, which there are always things that neither the patient nor us know about that are going to influence the patient. And then it goes to like personal things that influence it, and then out to like the family, the community, and then finally like the environment that they live in and how they all influence the patient. I think it's important to consider all of that, because especially when we're talking about like very diverse group of people, given like whatever's going on in, you know, the political realm, or you know, like the geopolitical realm can definitely affect like different races and ethnicities. And so I think like that was like one of the biggest concepts that I took away from it, is using the, like, it looked like a pie graph that was in the text, talking about the different things that can influence an individual.
I think also going off of the like pie graph that Parnell uses, I thought it was interesting the different like social and environmental and just like personal factors that he takes into consideration, just because I think that sometimes we don't really take these into consideration when caring for a patient. I know that a lot of times, like there, as we talked about earlier, like on Epic, there is those like boxes, but a lot of times they're just like not filled out or taken into consideration. So kind of going through like the model can help kind of like produce that culturally based care, just because you kind of take into consideration more factors about the patient.
Yeah, absolutely. I think it's also important to keep in mind how the patient and their family um, think about death, because it is a possibility with any serious surgery like this. If there are any practices or behaviors that they would like us to do before the procedure, for example, or how they would like to be treated if there were serious complications like that. And additionally, what kinds of things give them strength, like if they're practice any kind of prayer or meditation or anything like that, would be good for us to know, to make time and space for that as we can. And then again, with Purnell's model, what would we as an organization and a healthcare team need to do to implement those practices better into our care?
According to Purnell 2005, this model not only helps guide the development of assessment tools, but also, like I said earlier, just helps create more individualized interventions. So, like the reason why an organization would implement this is just to help nurses and physicians, you know, understand the various attributes of different cultures. And what we were just talking about in our last module, implementing this model can help reduce, you know, biases and prejudices that we may have towards people that we don't really know or like are acknowledged. So then this assessment will help, you know, better create a better understanding of cultures, and then make our providers and nurses more culturally competent, so that, you know, their care isn't affected by the biases or prejudices they may have.
Of course.
Yeah, kind of just to expand on that, like Douglas et al. 2014, in the article, it indicates that the evidence shows very clearly that like culturally competent nursing care contributes to reduction of health disparities and to equalize like the patient, and to improve patient empowerment. And so, like going off what Sarah said, I think like this individualized approach, both like modes of thinking, and helps to like equalize the playing field, so that the different cultures can get the same level and standard of care as anyone else would that isn't othered by the healthcare community.
Yeah, and that's super important, of course. And I know we talked a little bit earlier about how important it is to educate healthcare workers about the importance of these new methods or new assessments, so that they understand why they're doing them. But what else can we do to help a team implement the model, the Purnell model?
I think education is like a big part of this, just because if you're going to implement this model, you kind of have to like understand like why you're doing it. And I think in our healthcare system, a lot of like the things that are implemented lack the necessary education to be like implemented like effectively to like best serve like better patient outcomes. So I think like that being like the most important part, but also just for it to actually like kind of happen on the floor and like the inpatient setting too, is like putting the questions like into a patient chart, or like requiring the model to be filled out by like the nurse upon like assessment when a patient's like admitted to the floor. So like the primary nurse, like kind of like going through the model and like asking the patient all of these questions, but then also finding an efficient way to kind of like pass this on so that it's not like lost through, the different nurses that like the patient engages with. So maybe like doing it where you have to update this information every like couple days so that it's not something that's just kind of like filled out upon admission and then like pushed to the backside and forgotten about. So that would also like involve the nurse manager and kind of like making sure that there's like follow through on it.
Yeah, I
Definitely.
agree with Tara. Similarly to like how we have to update the care plans in Epic each day, like that could be something that is like touched on with each shift, is like talking with the family to see if there's like any new changes, anything that they've thought about since then, and then I could just be updated similar to a care plan so that the nurse can be well aware of it and any developing changes, because these things can change as like their prognosis gets better or worse depending on like what's going on with their medical stability.
Of course. And Tara, I think you touched on a really important note there, that implementing all these changes, hospitals are always changing things because they're always trying to be better, but doing so without education can really contribute to staff burning out or feeling like there's no point to these changes and just becoming exhausted. Um, so how could we make it known to both the staff and the patients that implementing this model and making these changes are really making a difference?
I think just like kind of how hospitals do like the fall intervention, like something similar, like a lot of times during like meetings, like before shifts and like after shifts, they kind of talk about like, oh, these are like the outcomes, these are the success rates that we've experienced over like the past couple months. So with like post-transplant care, kind of having like these regular team meetings, being like, hey, like we implemented this and these were like the positive outcomes, or like if it didn't go so well, hey, we implemented this didn't work, like how can we like change it to make it kind of like a team thing where people feel like they're really involved in the change and they're seeing like how their part has contributed to like positive like patient outcomes.
Yeah, I
Yeah.
think it would be important to like assess like how the patient experience goes as well. I know I believe it was, I think it was the Baugh article if I'm remembering correctly. They used the Likert scale, kind of to see like if there were any changes being made. I think like using a Likert scale for a patient to see if like the care resided within like their cultural norms and like within what they were comfortable with would be a huge indication as to whether the implementations that we're putting in are effective or not, and kind of like seeing if that changes over time as more nurses are trained in like multicultural care and stuff like that. Because I think it's easy to measure like documentation in Epic, but that doesn't necessarily correlate with patient experience.
Yeah, I think that would be a very good way to measure or at least notice outcomes in patients on the floor using the Purnell model. So just really quick to wrap everything up, one insight that I gained this week was about how many different things can influence an individual's culture. It's not just their race or religion or sort of the more hot button topics that we hear about more, but there are just so many more factors that I realize that I need to be incorporating into my thought process. Did you guys have any insights that you gained from this week?
I pretty much had the same thing. I always kind of knew that like culture played a role in that you should assess or like ask questions about it. Like nurses and stuff should ask questions to patients about it. But I feel like it's something that is very much forgotten about or kind of just like pushed aside, like, oh, that's not as important. I work at like a rehab unit, and there's like always a little piece of paper that says like, would you like spiritual service to come visit? And like patients can say yes or no. So like even just little things like that, like asking that simple question, I didn't realize like how much of an impact that can have on patients, because some patients like that's all they look forward to. And so learning that like this plays such a big role in a patient's like healing just kind of opened my eyes to that, like when I'm in the actual bedside nursing in the next few months, that I'm going to like actually, take the time to ask those questions and like make it important rather than just forgetting about it.
Yeah, I think my big takeaway came from the Purnell text, and it was kind of that center circle where it's like the unknown variables that are affecting the individual. Because I'm like a very straightforward person, so like if there's a problem, I want to like find an answer to it, and vice versa. So it's like kind of like accepting and realizing that sometimes there can be unknown things that are affecting this patient, their care, the outcomes of like what they're going through, and that the only thing I can do is try to help and like facilitate a caring environment for the patient based on like what we can change, but that sometimes it's just going to be some unknown variable that is affecting them.
I think my big takeaway was from Langer's theory, just kind of the like 3 modes with like preservation and maintenance, accommodation, negotiation, and restricting and repatterning, and kind of like using these to reframe like the nursing actions for the patient to kind of like make their care more individualized.
Well, great job, guys.